Hello YouTube, or whoever's watching this. Today I'm going to be talking about Anatomy of an Epidemic, subheading Magic Bullets, Psychiatric Drugs, and the Astonishing Rise of Mental Illness in America by Robert Whittaker. Now what this book tries to examine is the idea that we've had a pharmacological revolution in the past 40 years in the United States, right, with all these new psychiatric drugs and magic bullets to cure these disorders, yet at the same time we see a huge rate of people on disability in the United States for mental illnesses, as well as people who have mental illnesses outside of, being on disability for them. So how can that be, right? That you see in the news, or you hear about all these drugs that are coming out that are supposed to help people with these illnesses, yet we see so many people getting these illnesses and at higher rates than ever before. And what this book alleges is essentially that, based off of the data that Robert Whittaker looks at, is that these psych drugs and these neuroleptics, as you could also call them, are actually harmful rather than positive for somebody, and that ultimately the treatments that are currently being utilized are bad, for lack of a better word, in the long term for a lot of people with mental illnesses. Now, obviously, that's a very controversial finding. Many of you may disagree with it. I would encourage you to read the book and look into the studies and make that assessment for yourself about that. And, obviously speak to a professional. I'm just some person on YouTube talking about a book. So don't come at me. Anyway. So one of the things it talks about, for example, is SSRIs. So SSRIs are a treatment for depression, and essentially the argument in the past was that there was a chemical imbalance in the brain, and the chemical imbalance would be mitigated by a drug, right? Now, ultimately, this chemical imbalance thing has kind of gone out of whack, because when we look at brains of people who have ADHD or have a mental illness, we don't see a chemical imbalance in people who would be considered neurotypical. So that theory has kind of gone out of the way as time has progressed. But when somebody takes an SSRI, according to this book, the person does experience a chemical imbalance, right? And what happens is that if they go off the SSRI, they experience a withdrawal, or they experience negative outcomes because they're no longer taking that SSRI. So then they're given another drug essentially to counteract that the effects of the SSRI. And then, long story short, they're on a consistent stream of getting a new drug in order to mitigate the effects of the old drug. And while they may think that the drug is helping them, and it could be in the short term, it ultimately is probably creating side effects that they may have to deal with down the road. So that is all to say that the psych drug is not is maybe solving an issue in the short term, but ultimately is leading to a chronic situation where the person is taking these drugs forever. And what Robert Whittaker tries to show is that sometimes it's better to do nothing at all. Now, one of the studies he cites is about schizophrenic patients. And he compared, I think it's a WHO study on schizophrenia, where they follow these people who have schizophrenia in developing countries who are not receiving a treatment, and they follow people who are receiving treatment with drugs in the United States. And what they have found is that the people in the developing country over the years had better outcomes. They had less symptoms of schizophrenia after having no treatment at all. Some of their cases actually went away of schizophrenia with time, whereas the patients in America did not do as well and still exhibited symptoms at at least at a higher percentage than the group in the developing countries. Now, obviously, that is a incredible finding, and something that a lot of people, I'll put somebody who tries to refute his study, who is Robert, I forgot his name. Anyway, point is it's kind of like a bombshell study, and there are people who disagree with it. So I'll put a criticism down below, and then I'll put Robert Whittaker's response to said criticism right below that as well. It's kind of fun to watch them go at it. So then you may be asking yourself, okay, well, like, why would the psych industry knowingly give people drugs that are harmful, right? Because that would be my immediate assumption. What this book does is it maps the field of psychiatry, and what it says is essentially in the 1980s, a lot of, or I think it was like 70s, 80s, people were moving away from psychiatry. They didn't like the drugs, they didn't like where the movement was going, and psychiatry was being viewed almost as like a pseudoscience in a way, actually. So a lot of psychiatrists got together, specifically the APA, which I believe is the American Psychiatric Association, in order to embrace the biomedical model. Now, essentially what that means is that depression, bipolar disorder, all of that are brain disorders that can be solved with drugs, similar to like diabetes with insulin, right? So they came together and they pushed for the biomedical model in the 70s and 80s. And part of the reason for that, now there are many ways to view this. As I said, it's quite controversial. One of them is that it was funded essentially by pharmaceutical companies that are selling these drugs. I forgot the name of the one that is brought up a lot. I think it's like Eli Lilly or something along those lines. And Eli Lilly would give money to the APA, the American Psychiatric Association, in order to sponsor events where they would have experts talk about drugs that they were producing, and they would make billions of dollars off of these drugs. So Eli Lilly are the creators, I believe, of Prozac, which is a drug to treat depression. So essentially what you have happening in the 1980s is these psychiatrists coming together with these pharmaceutical companies to legitimize the field of psychiatry, to embrace the biomedical model, and kind of reshape how the American public views psychiatry, rather than like a pseudoscience, which, you know, is concerned with lobotomies and electroshock therapy and all of these things that a lot of people view negatively. And it's more, hey, no, actually this is a respectable field, that we look at the science and we have a disease and we are tackling this disease. One of the most interesting parts of this book is how they also frame their enemies. They didn't frame, actually that's a lie. It's not that they framed their enemies, but they had the opposition to them were Scientologists in a lot of ways, right? So L. Ron Hubbard, I was believed, was heavily critical of the psychiatry movement. I think he was kicked out or something along those lines. And L. Ron Hubbard is the creator of Scientology. So effectively, and he pushed the Scientologists to be very against psychiatric drugs. Like if you see, I think like Tom Cruise is very against psychiatric drugs and speaks out against it. So APA was able to frame the debate as, hey, look at us, these doctors with our lab coats and, you know, all of this reputation and university clout and all of that kind of stuff. And on the other side are these Scientologists who are cult-like and crazy and in a lot of ways. And I believe, you know, you see torture of members in Scientology and physical abuse and mental abuse. And it was kind of like almost like flat earthers, I guess you could say. I don't know if Scientologists are flat earthers, but they were able to frame it in that way of like science versus non-science. And that was a really effective measure by the psychiatrists in the 1980s and 1970s. So long story short, a lot of Americans bought into this model, and we saw the dramatic rise of people taking psychiatric drugs. And then eventually, the psychiatric drugs found their way into treating children as well, for ADHD, depression, what have you. And we see the dramatic rise in that as well. And the issue with this is that the outcomes, when Robert Whittaker goes through a lot of the data, shows that ultimately SSRIs have a very complicated history, and Ritalin and a lot of these things, in that, like, let's go into, for example, Ritalin. Ritalin, with a child who has an outburst in the classroom, the teacher doesn't like that behavior, right? So they may recommend that the child sees a doctor or a psychiatrist or something, and then the child is prescribed Ritalin, and the teacher is happy because the child is no longer disruptive in the class, because the kid mellows out and he's, you know, not really talking, it makes you less sociable, it makes you less excitable, so he's quiet now. But he has lost a lot of vibrancy that he may have had before he was taking the Ritalin. And in addition to that, he's better at focusing on routine tasks as well. When he takes the Ritalin, he's able to focus on those tasks. So in a way, the Ritalin is shaping him for the society. And in that way, it is a positive for the teacher, because the teacher no longer has a disruptive student in the class. But it's questionable about whether or not that is beneficial for the student themselves, right? So that's an example of how you can have a drug that is successful at achieving a societal aim of sedating a student, essentially, but is not successful at encouraging the self-actualization of said student, right? Now, in order to do that, you'd probably have to have a more difficult approach. Maybe you'd have to hire more teachers in order to have more focus, you know what I mean, of a teacher on students, because you need a smaller class sizes or something along those lines, or you need to readdress the curriculum, right, to be more individualized, which is very difficult in a lot of ways. That way the student feels more engaged and they're able to play around with things that they like. Or you'd have to avoid this model of just sitting kids in a classroom all day and let them, I guess, have fun, which doesn't sound that bad, especially if they're very young. So anyway, so that's an example with Ritalin of how the drug itself doesn't necessarily, it's not necessarily producing, as I said, a bad societal outcome, but not allowing the student to achieve self-actualization, which I thought was fascinating. And what else do I have notes here, by the way, so if you see me looking down. The thing is, though, Robert Whittaker doesn't just take this approach of like, oh, all these things are bad, you know, benzos producing these terrible withdrawal symptoms, SSRIs and Prozac and all these things causing suicidal thoughts and terrible outcomes in a lot of the people that take them, treatments for schizophrenia that are actually prolonging their symptoms. He goes into all of that, but then he's like, okay, what's the solution here, right? Because, which I really appreciate. I don't like a book that is just entirely negative, because it's like, well, what do we do now? I feel that way with some people who I watch and read. So he talks about how in Finland, they've actually taken a model that's called the open dialogue model of therapy. So what that means is, let's say you have a son who you believe is having a psychotic episode. You would call the hospital and they would come and they would sit down with you and the son and your whole family, and they'd even encourage teachers or if they're in a job, their employer or somebody to come in, and they'd have an open dialogue about what you need or your son needs in order to succeed. And if the son wants to go to his room and continue to freak out, he's allowed to. They're not going to take him down or anything like that. He's allowed to go to his room. They just encourage him to keep the door open. That way he can hear what's going on in the conversation happening. And what they've shown with this model is that it's actually very good at producing outcomes where the student feels like they're a part of it, the solution. So, and the outcomes so far have proven to be really good. Because Finland, in the psychologist's thesis, is essentially that what produces schizophrenia is not necessarily a, I don't know if they would say it's a mind thing, but it's more of frayed social relationships, and it's about restoring those social relationships. That's why it's so important to bring the family or bring people from their profession or school into the conversation in order to help the individual succeed. So that's what he talks about in terms of Finland, and he also goes into other models where they're medication-free at first. So essentially what that means is somebody comes into the program, and this is happening in like Northern California. He talks about a program there where they try their best not to put the person on a medication right away. They try to understand what the person's going through. You help them even withdrawal through the withdrawal process if they were taking another medication at another facility, which can be extraordinarily difficult, especially with a benzo. I could make a whole episode about benzo withdrawal, video about that. Anyway, so they could help them through that withdrawal process. And then they tried to do open dialogue method where they talk the person through the issues that are going on in their life, and they try to understand what happened in their life previously. And that model has, it's hard to say because there hasn't been a long-term study of the facilities, for example, in Northern California. But at the same time, Robert Whittaker is like, okay, we don't need to look at these long-term studies. Let's just look at the people who are currently at them, the kids. And he said, based off of his experience there and talking to the teachers there, that the kids were really thriving and that they were having a great time and they weren't being sedated with drugs, which we see at a lot of residential facilities for youth throughout the United States. Is oftentimes drugs are used as a method of control, whether it be Seroquel or one of these psychiatric drugs that causes students to just kind of zone out. It's a really interesting book overall, and it has some really interesting ideas in it, and I think I'm still processing it. I think you could tell I'm kind of rambling a bit here about the book, but overall I think it presents a pretty compelling argument and is definitely something to think about given the current consensus around psychiatric drugs in the United States, or at least what I perceive as a consensus, and presents a whole new way of looking at it. It kind of reminds me, maybe this is like a dramatic statement, but it kind of reminds me of Upton Sinclair, his book The Jungle, where he exposed the meat industry. I feel like Robert Whittaker here is just exposing the psychiatric industry and the ties in terms of money they have between these pharmaceutical companies and psychiatrists, and also what led to that. It really is, I found it to be really incredible. I'm going to have to look into research refuting it now, essentially. Like, I want to see what the other arguments are. I read one person's a couple of the critics, but maybe I need to look at more because, as I said, it's pretty startling, the conclusions that he comes to in this book. And also, the last thing I want to say, by the way, this is a rambling thoughts video, so I can ramble all I want, is it makes me cautious about new psychedelic drugs that are being considered, you know, miracles, right? Like whether it be psilocybin or MDMA or something along those lines for treatments with depression. And I think this book, after reading it, it makes me more cautious. It's like, yes, those drugs as well, psilocybin may be a great drug at helping people with, you know, a terrible illness, depression, or whatever, but also we should be tentative about jumping on board and saying, oh, these are miracles, before we actually see the scientific results at a broader population, because right now it's a pretty limited population. So that's my view on Robert Whittaker's Anatomy of an Epidemic. Highly, 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 highly recommend you check it out. I'd love to hear your thoughts and what you think about it. And if you think it's bogus, let me know. I'm so interested in seeing different viewpoints. It's also, yeah, anyway, that's all I'll say for now. Thank you for watching. Bye-bye. Have a good day.